And good evening, everyone. Thank you again for joining me back this week for another episode of HR in the Dark, the video podcast that exposes the dark side of HR. I am your host, Stephanie Lomax, CEO and HR strategist with HR Pro for You, an HR consulting firm that helps businesses to embrace HR. And today, I am very excited to have my good friend and business benefits expert, Kris Dunlap, with me today to talk through benefits conversation. So certainly amid all the COVID situation that everybody is dealing with, benefits sometimes may seem like not the right conversation to have at this point, but I am certain that it is a great conversation to have at this point. We're going to talk a little bit about that and why it's important. We'll talk about some benefit trends and all that good stuff related to benefits, specifically group benefits and benefits for small businesses. So I am going to turn it over to Mr. Dunlap here to give a quick intro. Mr. Dunlap.
Good evening. Good evening. How are you today?
Fantastic.
Okay. All right. So Stephanie just said that I've been in the benefits world for upwards of 25 years with various companies. Started on the carrier side with Aetna, Kaiser, and United. And most recently, I spent 10 years on the brokerage side, really helping small and large businesses with their overall spectrum of understanding from the employer side, as well as talking to employees as well. So it's made me more well-rounded in that field. I don't know if the word expert is a little overkill, but thank you, Stephanie, for giving me that great introduction.
Absolutely. I believe it. I know that when I have benefit questions, you're my go-to person. So in that realm, I say expert.
All right. Thank you. I'm flattered and thank you very much for that.
Yeah, absolutely. So let's talk a little bit about kind of what the state of company benefits looks like. I mean, I think that traditionally it looked one way. There was a transition that happened somewhere right around the time, a big transition happened in 2010 with the Affordable Care Act. That really changed kind of the landscape of how businesses offered benefits and if they were going to even offer them at all. But now that we're in this pandemic situation, let's talk a little bit about what that looks like for companies now.
Yeah, and just taking a step back, just like you mentioned in 2010-ish, going forward, I think a lot of companies looked at high deductible health plans and things like that as a silver bullet to really continue the employee engagement part of benefits. It didn't really happen because a lot of employees didn't understand those benefits, and they really just said, okay, I don't have insurance, and swiping their cards and calling HR, and it takes employee engagement to do that. Yes. So as we know, that part wasn't the silver bullet. Now, let's face it, the pandemic has created a frenzy. So it's the reliance on HR has gone out of the roof. The employees have to understand their coverage. Yeah. There's no crutch anymore. With that change, we've seen 41% of employers have to adjust to people working from home now.
Yeah.
With that work from home part of the benefits, it is incumbent from the employer standpoint to make it happen, to make sure that they not only understand the benefits, that they do actually initiate that part of it. Mm-hmm. I've taken a few notes that I wanted to go over, but the flexibility and the work schedules with employees has really put the onus on HR to make sure that they understand it as well. A lot of online resources, but let's face it, a lot of the blue collar workers don't have the flexibility of having that luxury of doing a lot of the online resources.
Right.
So they relied on call centers to make a lot of these things happen now. So a third party vendor that has a call center that have walked through step by step with the employees to have them understand the benefits has been the trend lately.
Yeah.
Overall.
Yeah. I mean, I think, you make a few really good points in that. Number one, I don't think that I really realized the magnitude of the impact that this would have on HR, because I mean, HR really touches so many components of the business. So it's recruiting, it's compensation, it's benefits, it's training, it's performance management, it's all of those things. And every single one of those aspects has been affected in some way, shape, or form because of the pandemic. But I want to talk about two key things. The high deductible health plan. Yeah, so I remember when that happened, and you're right, it was this mad rush for all employers to just hands off, this is what we're offering. It was a lower cost option for the employee and the employer, but out of pocket wise for the employee, again, it was an education thing. And it
Yeah.
wasn't something that I think a lot of employers thought through very carefully because they didn't go through the process of educating employees about what that actually meant. So people did feel like, well, why do I have insurance if every time I go, I got to pay out of pocket? You
Yes.
know, so that was one major shift. And then the other piece you're talking about is like the using the call centers for a lot of people to handle particular questions and concerns, and them also leaning on HR too,
Yeah.
because you know, they don't understand. And I tell people all the time, you know, if you don't speak the language, I understand. It just happens to be that I speak the language, so it seems like it's second nature to you and I, right?
Yes.
But to, I mean, my husband's an IT professional, and he brings me the stuff and is like, "Yeah, I don't know what to do with this," you know. So it's very different if it's not your world.
Yes. And I mean, I can talk about close friends of mine that call me frantically when they're making their benefits choices for the year. What
Yeah,
is this? What am I doing? Why is this? Because we have to understand, to the layman, the first thing they see is the largest number on the page. They
yeah,
see that $3,500 or $5,000 deductible,
right.
and they think, and that is their out of pocket beyond the shadow of a doubt. It's understanding those benefits. And I know we're going to talk about one of these topics in a moment, but they have different types of insurance that will create a cash benefit for that gap in care.
Mm,
And people have to understand that part of your insurance benefits as well. You really have to be an educated consumer, just the same way you budget everything else. Look
yeah,
at your last 24 months of expenditures. Look at your last 24 months of inpatient care, or maybe pharmacy utilization, things like that, in order to forecast whether you should join a high deductible health plan. It makes sense for a lot of people and their families to join this plan. If you haven't been to the doctor in 3 years, yes, put
right,
that money aside. I look at it as if it's fixed costs and non-fixed costs. The
right.
fixed cost portion of your plan are your premiums. The non-fixed costs are your utilization, and
Yeah,
that can adjust year over year. So you take your time and do your homework and make the right decision for you and your family. And
yeah,
it's the same way that I talk to employer groups in the same fashion. Every employer group doesn't have a group of 20-year-old individuals. They
correct.
have people in all scales of life. In order to formulate the plans that are useful for all your employees, you have to take your time and do that.
Yeah, yeah. And I think it's really key that, you know, from an education standpoint, that employers really find um, people like you and I that partner with them to walk them through these processes. It's really
Yes.
easy to sell somebody something, you know, or give them hand them a solution, but you do really have to know and understand the population that you're dealing with and what their needs really are. I mean, at the end of the day, everybody wants to be protected, right?
Yeah.
So,
Yes.
but how we go about doing that is different literally for every employer group. It really is.
Yeah. And the first question that I ask employer groups is, where do you want to go with this? If
Yeah,
you just want to a quick fix, yes, we have plans that we can refer you for a quick fix. But if you really want to tailor something to the needs of your employees and their families, let's take a deeper dive conversation. Let's talk
yeah,
about compensation plans and where you're forecasting. And I keep on leaning on HR, but that's very important because
sure.
it's an overall spectrum of what you're doing.
Yeah, absolutely. Absolutely. So, kind of a segue into that, you know, what are you seeing or hearing out there, now that employees are looking for? Like, what do they want? I mean, I think medical, dental, vision is kind of like, that's like the norm. Like, nobody's getting excited about any of that. But
Yes, yes.
what else, what are people looking for? How can small businesses, attract new talent, let's say, with different types of benefit options? What are you seeing and hearing out there?
My first reference to millennials, but millennials are really savvy in this area. And they're savvy from the standpoint of cash benefits. They want to protect their tax shelters, having pre-tax benefits and cash for benefits themselves. So I'll give you an example. They are really adept at life insurance tax shelter plans. And I've seen the trend going towards those in a lot of cases. Believe it or not, they're doing a lot of long-term care policies. They see myself and our parents and grandparents struggling with long-term care as well. The other trend that I've seen really that's knocked it out is disability type plans.
Okay.
They do want to have that shelter to protect their income, because let's face it, next to health insurance, my second most important benefit is protecting your income.
Right.
Short and long-term disability has been a large trend as well. From the employer standpoint, the insurance companies are being very aggressive about keeping their business right now. So as a small group yourself, out-of-pocket costs have been minimal. A lot of those increases have been 7 to 10%.
Okay.
I mean, that used to be a time when I was back in my carrier and then United days, I would deliver in a 30% increase.
Wow.
And I would stick that under the door on a Friday afternoon and run. But now I've seen those stabilize a lot. Those stabilize a lot. You've seen that that carriers are really rolling up their sleeves to keep their business. So it's to the advantage of a small group employer right now with that.
So with those plans that you mentioned, like the disability plans and the life annuity plans and the long-term care plans, are those plans that the employer has to contribute to, or can they be completely voluntary?
Completely voluntary benefit plans that the employee pays out of pocket for, but they're, in some cases, they're pre-tax benefits as well.
Okay.
The most important part of those plans, they are age-based. So if you lock into an age at a rate at a certain age, you can keep that rate going.
For the plan.
Yeah, it's a great plan altogether. Yeah. So if you team those plans with what we just talked about, a high deductible plan, that provides the gap. And it does give you some kind of surety that largest number on the page, that $3,500 or $5,000 deductible, doesn't have to be all your responsibility. You have something to lean into that.
Yeah. And can flexible spending accounts can also kind of help to fill that gap. It's another pre-tax option. So if you have that high deductible plan, you can set aside dollars to help fill that gap to get reimbursed for those monies that you pay out of pocket as well, right?
Yeah, but it does take for the employees to do their homework.
Yeah.
Because you don't, I mean, people are scared of flexible spending accounts for the wrong reasons, because there is a use or lose it type benefit, but they do have a few safeguards where they have a $500 rollover in a lot of cases. They do give you a 90-day past their extension date in order to use those funds as well.
Yeah.
But it does take for you to engage. I mean, I keep on saying this, but it's very important that you're engaged with your health care the same way you're engaged with your auto insurance, the same way you engage with your life insurance. Let's roll up your sleeves and get that done.
Yeah. So I'm a huge fan of flexible spending accounts. I think they're great. I mean, we have 2 young kids, so it takes care of dependent care expenses, summer camp fees, a lot of things. And I also know that, that whole use or lose situation can be a little scary. Now, for employers, I think initially, and it's probably not as much of as much of an issue now, because I think it's become more mainstream. But I know that, for example, on the health insurance side, on the health care FSA, employees have access to those dollars the day the plan takes effect. So let's say the plan year is July 1 through June 30th, and they said they want to set aside $2,500 to pay for medical expenses, they have access to that $2,500 on July 1st.
Correct.
They use all $2,500 on July 1st, and then their payroll deduction catches them back up. But if they quit September 30th, the employer is out the money.
Yeah, we don't want to put that in the air, but yeah, that isn't exactly a true statement.
But I mean, so I think I'm saying that to say that at one point, employers were limiting the amount on that health care because they were trying to limit their potential exposure of losing dollars or leaving dollars on the table.
Yeah, and in the long run for an employer, it does even out.
Yeah.
Because you have some employees that don't use those funds year over year, that don't even take advantage of the rollover benefits, and
Right.
it does even out. I haven't had an employer group that really is hesitant about offering those funds to employees because of the fear of them leaving.
Right. And I mean, and it's not like it's going to be everybody quitting at once.
Yeah, exactly.
And not everybody has the FSA either. So
Exactly.
yeah. I saw something though on my husband's plan for his FSAs. We re-enrolled in it again this year. And normally they have a 90-day rollover, 90-day window to use the funds.
Yes.
I saw something I was actually on the app on the phone. I haven't looked at it on the computer, but there was a December 31st date listed instead of a September date, which is what it should be, because it would be a 90-day for July, August, September. So I'm trying to figure out, have they extended that an additional time frame because of the pandemic that's going on? Are they allowing people more grace period there?
Haven't seen that yet, but I would imagine that would probably be an IRS regulation that's come lately to make that accommodation for everyone, because they know that people flat aren't going to the doctor right now.
Right.
And a lot of the virtual visits, and I meant to mention that earlier, which triggered something. The employee change towards virtual visits. It was taboo for a long time. They didn't want to see a doctor online. My 81-year-old mother did a virtual visit a couple weeks ago, and she thought that was the coolest thing ever. But it is a part of our daily living now. The increase has gone out of the roof. A lot of the plans come with those standardly now, and employers can take advantage of those at just their regular office visit copay. And in a lot of cases, even if you have a high deductible plan, they'll waive the deductible in those cases as well. They have a set dollar amount to do that too. Right. It's something that that we do go through when we talk to employer groups as well.
Okay. All right. Yeah, this is a lot of good information. So, I mean, we kind of talked about, this is one thing. So the IRS regulation, now I got to go look it up because I got to find out if that's really.
I'm pretty sure that changed, because we've seen a few changes, and I may have missed that. I was looking for the big fish, and usually when the conundrum of it, just the FSA stuff is, and the secondary, but it does.
Yeah. So what it looked like is they added another 90 days onto the extension. So whatever his plan year, July 1 through June 30. So instead of giving them 90 days, they gave them like another 180 or 6 months to, I guess, incur the expenses or whatever. So I have to look that up, and I'll follow up on the podcast after the podcast with a follow up on that. Just to kind of see if what I saw was what I think it is. But so that's one thing that's a potential change that has impacted benefits. Or what other, and televisits is another thing that has been impacted by COVID-19. People doing these online visits with doctors and then making accommodations for those types of visits, and becoming more popular for them to do them. But what other impact are you seeing on benefits in general because of this pandemic that we're in the middle of?
An often overlooked benefit that I've seen that's really taking shape in the last couple of years, as well as increasing during the pandemic, is an employee assistance program. A lot of employers don't offer that. They see that on an employee would see it. What is EAP? No, it's EAP. It's an employee assistance program, and it's actually there, and it's a great or underutilized benefit. that in most cases you have 3 face-to-face visits with a lot of clinicians, talk about anything. Most of the time it's mental health type visits, but they have unlimited online resources, and it's pennies on the dollar for an employer to offer these types of benefits. And in a lot of cases, it's for employees and their families, whether they're covered or not covered. So I've seen the increase in that, and I've had a few employer groups reach out to us because it's outside of the realm of the health insurance vendor. They're usually connected with the life insurance carrier or disability carrier.
Okay.
They offer those EAP or employee assistance programs with that.
Okay.
So that's another trend that I've seen, and I do try to get employers to include it on all of their plans, because who knew a pandemic was coming? Who had the foresight to know it? So this is just something that we've seen as well. Virtual visits, and again, the employee assistance program.
Yeah. So just so I'm clear, if an employer doesn't have an EAP through their carrier, through their medical insurance carrier, they can get that through some other carrier, like life insurance carrier, you said, right?
Yeah. The limited benefits that are offered through a medical carrier are state mandated. So you see sometimes they're tagged along with it.
Yeah.
Off the top of my head, Kaiser is the one that I see that offers it through their medical plans. Okay. But it's all often connected with your life insurance and your disability insurance if your employer offers that.
Okay. Now, if employers don't offer those things, what would you recommend? Where should employers go? Or should they just offer the plan so they can get it? Like if they don't have disability or life insurance plans in place, do they still have an option to engage an EAP resource?
Yes, they have outside EAP vendors that offer those pennies on the dollar to your employees with all of those things that I talked about. As a matter of fact, I had a group that added a benefit, an EAP benefit through an outside vendor. Less than 2 weeks later, one of their top executives passed away suddenly. They had crisis intervention in their office with licensed clinicians to work through that time in their business. And that ended up being perfect timing for it.
That's an amazing story.
Yeah. So it does work, and it is effective. And until the time comes, you don't need it. It's just like life insurance. I hate to say it. You're planning for the future. So it's a necessary benefit.
Awesome. Yeah, I'm a huge fan of EAPs as well. I talk about them a lot with my clients, and just in the HR community, we talk about it, and especially now we're talking about it even more because it's such a needed benefit. Even when people don't really think that, it's kind of beyond if you have a diagnosed mental condition, right?
Yes.
It is more, it's way larger scale than that. It is, I'm stressed. I have work-related stress, or I have pandemic-related stress, or I have family-related stress that's going on.
Everything.
Yeah, exactly. And this is a resource that employees and their families can take advantage of.
And you think of the financial stress that's caused a lot of employees.
Yes.
Employer groups during the pandemic. Look at you, you're an elementary school teacher now, and it'd be difficult for you to deal with every day.
Yeah.
Of it. So it's certainly there for your use. And I talk about this always the last 5 minutes of our presentations that we talk to groups, but I try to make it as close to the top of it as I can. Yeah. Because it's such an important benefit.
Yeah, absolutely. Absolutely. Yeah. That lean on EAPs is critical. Definitely. So a lot of businesses, well, I guess there is a really popular time for it. So open enrollment. The most popular time for open enrollment plans is January 1.
Yeah. Yeah, it used to be, but
so that's a trend that's changing.
Yeah, we've talked to a lot of groups off that January mountain through the years. And it's January and July really still handle 70% of the renewal dates for employer groups.
Wow, okay.
But I do see the trend changing where they want to look at other dates. And depending on the size of the employer, I have more flexibility with negotiating with the carriers if it's off January or June, or
Yeah.
July, excuse me. Hint, hint to the employer groups out there that are listening,
Exactly.
because it does offer that the bigger pool of money to make sure that your renewal is a little bit more palatable
Yeah.
forward.
Yeah.
And I've seen people offer different types of voluntary benefits off cycle in order to supplement the January or July renewal dates too. So we've seen a little bit more of that trend.
Okay.
But from the insurance standpoint, it's no let up in months on end. It's January and July, but every month there's a renewal time, and there's
Sure.
time to negotiate and work with groups to make sure it happens.
Yeah.
And I can't say this enough. An insurance contract is an annual contract for your renewal, but you can switch carriers at any time.
Yes.
I can't say that enough, because if their employer groups, so small group employer groups listening to this, don't pay your premium for 60 days and you will stop. So it's an annual contract, but you will have to pay your premium, and you can switch carriers.
Yeah.
So you're bound in that way.
Gotcha.
Okay.
So with open enrollment, I guess we just got through like the second most popular window for July 1 renewals. But for those that are coming up, like in the coming months throughout the rest of this year, what are some things that employers should be expecting as they're approaching open enrollment?
So you want me to wave the magic wand and tell them what their renewal numbers are going to be?
Yeah, what is that going to look like exactly? I'm thinking about that. Like,
Yeah. As an employer, everyone asks us that same question.
Yeah.
And it's done carrier by carrier, really on a quarterly basis. We can track where the carriers are going. Sometimes, and I'm talking about medical carriers, so let me straighten that question out. It depends on the carriers in growth mode or retention mode.
Mm-hmm.
And in a lot of cases, we do catch the trend because we've been around doing this so long. We can advise you which way to go in this way. Okay, United Healthcare is hot on this product. Be willing to look at that.
Mm-hmm.
Kansas in this area, let's do this, or Care First, or what have you. So we can track it that way. What I've seen for the first 6 months of this 2020, I don't want to forget, has been most of the renewals have stabilized to the point, like I said before, 7 to 10% in a lot of medical insurance carriers.
Okay.
The disability and life, I'm sorry, when I speak disability, I mean just long-term and short-term disability and life insurance. Those have really stabilized. I've seen them give 2-year rate guarantees, meaning zero for 2 years in a lot of cases, because they are really in retention mode. So any small groups out there that do have those disability and life insurance plans, you shouldn't see any increases.
Okay.
So,
that's awesome to hear.
Yeah.
Awesome. All right. So we've used a lot of words to describe different types of benefits. So let's just, for the edification of those that are listening that might not know kind of what the difference is. So company sponsored benefits are what?
Company sponsored benefits, that's a trick question, because we do have different levels of company sponsored benefits.
Okay.
But I'll start from the beginning. You have a portion of your company sponsored benefits can be offered as a health, dental, and vision plan.
Okay.
Most company sponsored benefits for health insurance start at least a 50% contribution from your employer.
Okay.
And you pay the rest. Some employers pay up to 100%.
Mm-hmm.
So that would be under the realm of company sponsored, and it would mean that you have a pre-tax benefit.
Okay.
So that means your premium will reduce your tax base, so you don't have to deal with Uncle Sam in that way, and helps you out that. So that's how I would loosely define company sponsored.
Okay.
Pre-tax benefit in that realm.
And it's the ones that we see that are the most popular, that earlier in the conversation I was saying it's kind of like a standard thing. So there's nothing, for lack of a better term, like super sexy about medical, dental, vision. They're all kind of, and people are expecting they're going to get at least that.
But you have to dig into the details, because company sponsored for a health insurance plan, they may pay 100% for the least
Right.
inclusive plan, and then you have to pay 100% more for the Cadillac plan, for example.
Right.
So you
Or
have
they
to do,
may pay the employee portion and then you have to pay for the dependents. That
yeah,
doesn't
so
work.
you just have to do your homework. It's up to your utilization, because we have so many people out here, and I wanted to use this term earlier, but some people that are sponsored by their employer group, and they're overinsured
Mm,
within their employer group and don't utilize those benefits. For example, you see the PPO, just sign up for the PPO. You don't know what the heck a PPO is versus whatever, but
right.
you think that's the best plan. But the best plan is for you and your family.
Yeah.
You don't, you may live in a rural area, you may live in downtown or what have you,
Hmm.
but you have to tailor the plans for your utilization,
Right.
because the best plan is not always a PPO.
That's right.
That PPO that you're talking about may have a $5,000 deductible, but its HMO might be first dollar, zero copay coverage.
That's right.
What's better?
That's right.
I mean,
Exactly.
you can't look at it that way.
Yeah. Yeah. Okay. All right. So that's the company sponsored benefits. And then we talked a little bit about voluntary benefits, but just so how would you define what voluntary benefits are?
Voluntary benefits are actually, employees get to make their choice within the voluntary benefits. Well, let's start from the beginning. The employer can offer a number of voluntary benefit plans. You see plans offered by companies like Transamerica, companies like Humana, companies like Aflac. Those are, since you see Aflac because they have the commercials, but
Yeah.
they're not the only people that have an accident policy. They're not the only people that have a hospital, a cancer plan, things like that.
Hmm.
Some of these topics are very vague. I mean, very deep topics that you're talking about when you're talking about a cancer plan, but
Right.
you don't really know how much the out-of-pocket cost when you have it. You look at your health insurance policy, you think it covers everything for your cancer treatment.
Hmm.
You forget that you need cash for gas, back and forth into the parking garage to go to the facility, the hospital.
That's right. Yeah.
So many of those plans offer cash benefits that fill the gaps, out-of-pocket gaps that you have in every part of that. So a lot of employer groups just offer this to the employees
Hmm.
as a incentive, because the incentive is your total benefits package that you're offering to your employees.
Right. Right.
These benefits are, in most cases, employee paid. Very seldom, maybe 10%, the employer pays for them as well.
Okay.
But they're locked in at a certain rate for that age, and they're great. This is the largest growing part of the insurance benefit world.
Oh, wow.
Yes,
So
this is number
with
one.
a lot of these voluntary benefits, so life insurance, supplemental life insurance, long-term disability, short-term disability, long-term care plans. Are those plans always tied only to the employer, or let's say an employee leaves, are those benefits transferable? Can they take those benefits with them?
Yes, and I forgot to mention that earlier. Thank you.
That's it.
Those are portable plans.
Okay.
They're locked into that rate. Maybe a little bit of price difference when you do take it away from the employer,
Hmm.
but most of the time that's pennies. But
Okay.
they are portable, and additional life insurance. Remember my first sales manager. There's no such thing as too much life insurance. So those updated life insurance plans are very important to lock into those at a very young age, if you can, as much as you can get, because you have to answer those evidence of insurability questions in a lot of cases as
That's
well.
right. That's right.
Let me back up for a second about that part. So if you see a plan that's being offered by your employer
Mhm.
on a voluntary benefits basis, in a lot of cases, you have to sign a waiver that you don't want those plans, but they're offered to the entire employer group at that point. That's how you're locking into that smaller rate.
Gotcha.
You lock into that smaller rate because, let's face it, that injury happens next week and you waive the plan, they're not going to cover you retroactively. So you have to
Yeah.
really take care of the space and time of offering and accepting those benefits or waiving them if you don't want. But
Gotcha.
that's the largest growing part of our benefit of our business there.
Wow. Yeah. I mean, I can kind of I understand why. So we talked about um, the millennials earlier, right? and how they want that cash benefit. And
Yep.
so there's certainly more of them in the workforce. And so I can see how
Yeah,
that's
we're dinosaurs now. Yes, you're right.
right. Well, they're like the older. They're almost like old news in the workforce
Exactly.
because you've got their kids now in the workforce, which is crazy.
Yeah.
But yeah, so I can see how that that trend has happened because they're a large part of the workforce nowadays.
Yes.
So
Yes.
okay.
Yes.
All right. Well, let's talk a little bit about some of the projects you're working on. So you are, in addition to just being, I'm my personal benefits expert, but my go-to person for benefits, but you are working with the Versia Group as the VP of Corporate Benefits there. So tell us a little bit about, talk a little bit about some of the projects you're working on with them and some of the great things that are on the horizon that you see for small business benefits.
Small businesses. Well, we at the Vicia Group, we concentrate on helping small businesses from alpha to omega. We really help them from the financial leg of setting up a small business from the beginning with things like financial planning for their families, moving into different areas when they are ready to move into offering. Maybe they have a brick and mortar building, so we handle them from a property and casualty standpoint. By me being in corporate benefits, obviously the things that we talked about for the last few minutes, I can help them out with setting up benefit plans, ensuring that the employees are set and their families are set in that realm as well.
Okay.
And from the financial standpoint, like I said, these guys my business partners are doing great work with local churches, local nonprofits, and helping them out in certain ways. So I think our network is growing tremendously. So I'll be in touch about some of the growth opportunities with the Vicia Group, but just corporate benefits is a small piece of what we're doing. We're really taking the bull by the horns in all the areas.
Awesome.
Yeah.
And I think that, having small business advocates that can cover all aspects of a particular component of a company's business is critical. So the fact you were saying, for example, it's not just corporate benefits, but it's all those other types of benefits that you guys offer for small businesses is amazing to kind of have that resource and have all that in under one roof and in-house.
Yeah, we really I have trouble giving a complete mission statement because we really listen. We really talk to each group and tailor our recommendations upon what you want to do. And that's, let's face it, now in these trying times, everyone has a different business need. So we really take our time and get through it. We do rely on, and this is not a commercial for you, we do rely on our HR partners a lot to help us out because they're, in a lot of cases, we're dealing with the C-suite of the employer groups, but we do rely on our HR partners a lot to really get the pulse of what's happening with the employees, how they want to move forward, how they want to tailor it. It's a human capital aspect to this. Yeah. And I think this pandemic has certainly made that the forefront of what we do.
Yeah, absolutely. Absolutely. Well, this has been fantastic. I mean, we talk a lot, about things that employees need to be thinking about, so if employees are listening to this, these are questions, and some of the things we talked about are things that you should be thinking about or looking at with your current benefits, so that you just are a little more educated on what's what. But for my businesses that are listening, these are some of the things that you should be thinking about in terms of how to move forward. The pandemic's not going to be around forever. People are recruiting during the pandemic. So all some of these things have to continue moving forward. And so, Kris, you were able to give a really kind of overall picture of things that employers need to be thinking about in terms of what they should offer, some opportunities they may have to move carriers without feeling like they're locked into a date, some little, nuances and tidbits of the industry that I think are very helpful to businesses. And Yeah, this has been fantastic. So if people want to reach you, what's the best way for them to contact you to get more information about what you're doing with the Versia Group?
Okay, so I can be reached at K Dunlap at the VersiaGroup.com. That's TheVersia
Yeah,
Group.com.
Versia Group.
Yes, and I'm sure you're going to contact Stephanie first, and she has me on speed dial, and
Yeah,
so
absolutely.
we work in conjunction a lot. I really can't thank you enough for providing this platform for us as well as small businesses. This is great. There are so many things that we can offer as consultants. All we need is the form in order to do it.
Yeah,
Sometimes I shake to remember how many times in the last 25 years we've gone from books to online and this to that, but nothing beats experience, and that's what we are offering. These
yes,
levels of experience, and we want to hear your story because we're not going to tailor make your product. It's not a cookie cut system. We have to
that's
take
right.
our time and listen. That's the
That's
best
right.
thing that we have here is time to listen. And let's face it, this pandemic has slowed our life down to listen a lot more now. So
That's right.
we're doing it. Like grandma used to say, 2 ears and one mouth for a reason.
That's right.
We're doing
Put that into action.
it.
Absolutely. No, this has been awesome, and I certainly appreciate you being willing to come on and have this conversation and share expertise. I know there were some great takeaways that I'm certain that those who are listening will have some takeaways that they can run with as well. Thank you all also for tuning in another week of HR in the Dark, the video podcast that exposes the dark side of HR. We'll be back next week, 9:00 p.m. Eastern Standard Time. If you are not already subscribed to the podcast, you can do so by going to www.hrpro, the number 4, you.com/podcast and subscribe. You can have the podcast dropped into your email box every Wednesday. You can also follow us on social media, LinkedIn, YouTube, and certainly catch other episodes on the website as well. I look forward to seeing you guys next week, and you guys have a great evening. Take care.
Great.
Bye. Thanks,
Thanks,
Kris.
Stephanie. All right, take care. Thanks, Stephanie.